going to start off. How many of you guys think that health insurance is pretty important? Kind of a good thing to have, like maybe you have it through your parents, maybe you're working and have it through a job, but no, whether you have it or not, it's kind of an important thing to have. Yeah? Kind of? Maybe?
Yes.
Okay. So, if we think that it's important, how many of you are willing, I guess first of all, let me explain, when you purchase a healthcare policy, what you pay every month is your premium, okay? Sometimes an employer pays part of that for you, sometimes you're responsible, if you purchase private insurance, you're responsible for the whole thing, but what you pay is called your premium. When you go to the doctor, your insurance will agree to cover part of it, but part of what you are required to cover when you go to the doctor or to the hospital or have a procedure done is called your deductible. So we're just kind of going through some vocab there. So if you think insurance is important, how many of you think that it's important enough that you would be willing to pay a $400 a month premium and $6,000 up to $6,000 a year in deductibles? Yeah, okay. So we're going to kind of play with some numbers, and I promise you this is not going to be real painful. Basic addition, not a big deal. I'm going to hand you guys each colored cards, okay? These are the cards that life is handing you. These are the cards that you have been dealt. Some of you will have brown cards on top, some of you won't. Don't open them, don't talk about them with your partner or with anybody close to you just yet. And we're not trading cards. Sorry, my fingers are cold trying to get this all to work, isn't it? Let's see, you have 6 cards. Everybody should have 6 cards plus a brown card if you have one.
And I'll be your 10th body. Can we?
Awesome.
5.
5, did I miss one?
3, 4.
No, you don't have to have a brown card. Some people do.
I have 2 brown ones. 3, 4, 5. Oh, 6.
You have,
Yeah,
awesome.
6.
2 red, I think. 2 red, a blue, a green, and 2 pink. That's, I think what we should have. Those brown cards.
What are yours? Are yours working?
And like I said, if you guys want to use your cell phones, not a big deal. We can roll with that too. I'm not too worried about it. Perfect. Okay, so one of the things that I will just throw out there at the beginning, most of the statistical information that I have, this is really broad, okay? This is very general. We're just kind of doing this to get a sense of how all this stuff works. There's always what ifs and buts and all this other stuff. So this isn't going to be, this isn't perfect. This is just kind of a roundabout idea of how some of this stuff works. The statistics were gotten from the CDC website, some from like healthcare.gov, some from Blue Cross Blue Shield, and a couple other sources, but that's where I'm pulling some of the statistical data from, okay? 4 of you out of 10 have brown cards. Those are your insurance cards, okay? For people ages 18 to 26, before the Affordable Health Care Act was enacted, more than 60% were uninsured, okay? So out of the 10 of you guys who have these cards, only 4 of you have insurance, okay? Cool. Let's see. In the pile of cards that you have red cards. Okay, basically each card that you have represents a time that you will visit the hospital. Okay, statistics say that in general, on average, people between the ages of 18 and 26 will visit the hospital between roughly 1 time a year. Okay, so we're talking 18 to 26, about 7 years in there. So each of you guys have 6 cards. That represents the number of times that you may visit the hospital between the age of 18 and 26. The red cards are for injuries. You fall down, big old cut, you need stitches, you go to the ER, that's one injury, break your arm. My daughter broke her arm a couple of years ago. It's a hospital visit. Blue cards represent respiratory issues, asthma, bronchitis, pneumonia, anything respiratory, that's a blue card, okay? Green cards are illnesses, you go because you've got a temperature of 103, it's an illness, that's a blue card, okay? Pink cards, most babies are born to parents below the age of 26, okay? Pink cards represent your 2 children. The statistics say that you may have it between the age of 18 and 26. So now we're going to play with our numbers a little bit. For those of you who have insurance, first off, one of the things that insurance pays for is birth control. Okay, not all insurance pays 100%, but one of the things that you can get covered for is birth control. So I want you to take one of your baby cards and hand it to somebody who doesn't have insurance, because you're less likely to have 2 children before the age of 26 if you have insurance. Nope, just one. If you have insurance, pick one card.
Brown card.
Brown cards do have insurance. So if you don't have insurance, you are receiving a card from somebody who does.
Because
You got 3
Walk
kids.
all the way.
I didn't want 3 kids.
Like everyone has insurance.
Has everybody handed out kids? Because I didn't receive another kid yet.
Oh, I already handed out a kid.
Yeah, and we may not have, do you have at least one kid?
Yeah.
Okay, cool. So hand her one.
Is
Awesome.
it a boy or a girl?
I don't know. They're all just kidding, and I realize that that's a little bit hypocritical, but whatever. Okay, second off, for those of you with insurance, you are less likely to visit the hospital. Why? Because chances are if you get sick, you're going to go to the doctor. If you take a look at your insurance cards, you can go ahead and open them up now. It gives some basic information. I'm going to have you guys one at a time read what your insurance cards say. Again, this is a general idea. This is not like it's not a hard and fast rule. Okay, so you want to start?
Sure. Cigna insurance card. Thanks to the Affordable Health Care Act, you may now stay on your parents' insurance till age 26. Your deductible is $300 a year. Your copays $25 for office visits and $75 for ER visits.
Okay, prior to the Affordable Health Care Act, most health insurance companies kicked you off when you weren't a full-time student anymore. After the age of 18, you were required to be a full-time student to stay on your parents' insurance. At the age of 21, regardless of whether you were a full-time student or not, you're done. You have to go get your own insurance, whether it's through your job, whether you have to pay out of pocket for it. The Affordable Health Care Act says that your parents' insurance companies are required to carry you guys till you're 26. Reason being is because a lot of kids between the ages of 18 and 26, if you're going to college, if you're working, entry-level jobs, you may not have the option of getting health insurance. If you're going to school full-time and you're not working, you're not going to get insurance through an employer. So one of the things that the Affordable Health Care Act says is that it's important for us to take care of our young people, and by young people I mean kind of us. I'm 26 this year, so that included me. So you're lucky, because prior to that, 18, you quit school, you're done. You go to school part-time so you can work part-time, you're done. You work an entry-level job that doesn't pay for your insurance, you're done. And if you get hurt, that 100% of that cost is on you. Okay, your insurance card?
Do I need to say the name?
Yeah, if you want to. They're, like I said, they're just examples.
Blue Cross Blue Shield insurance card. Your employer pays your insurance premium. Congratulations. Your deductible is $2,500 a year. Your co-op pays $25 for office visits, $75 per ER.
Okay, if you're really, really lucky, my husband works in the oil field. They make, those people make boo-boo bucks, okay? They pay his insurance premium. Doesn't happen very often. I've never had a job that pays my entire insurance premium. So you get that, awesome, you're in good shape. Next insurance card?
Geico insurance card. My employer pays part of my premium.
What's your insurance? Sorry.
Geico.
Geico, okay.
My employer pays part of my premium. I pay $150 a month. My deductible is $1,500 a year. Copay is $25 per office visit, $75 per year.
Okay. Chances are this is what you guys are going to be looking at. Get a job somewhere that say, yeah, we'll pitch in. We'll pay part of your insurance. You're working for us. We want to make sure you're covered. But you'll be responsible for $150 a month. That's your premium. You're obviously also responsible for your deductible. Okay.
I have Obamacare, and after trying to purchase private insurance for $468 per month, we were denied due to a pre-existing condition. So you purchase this insurance for $300 a month. Your deductible is $4,000 a year. My copay plans are $25 per office visit and $75 per ER visit.
Okay. Higher deductible, right? You're paying a little more out of pocket. But here's one other thing that the Affordable Health Care Act is kind of changing. Prior to Affordable Health Care Act, if you had a pre-existing condition, one of my friends had cancer in her hip, bone cancer. She can't get insurance or couldn't get insurance because they said that was a pre-existing condition. They said she was high risk. They wouldn't cover her. So she, even if she had wanted to pay $450 a month, she couldn't get it. They would deny her. Like I said, some of that's changing. Obamacare will cover you regardless of pre-existing conditions. Maybe it's not as good as some of the other insurance. Bottom line is you'll get covered, right? Okay, so now we're going to kind of delve into some of the numbers. If you take a look at your cards, when you go to the hospital, you have a 35% chance that you will receive an x-ray, okay? if you have, I think that they will be on your blue card or red card. You go to the hospital, you're hurt or you're sick and you need an x-ray. These will be black exclamation points. So if you have a black exclamation point on your cards, those stand for x-rays. And now we're gonna start adding some numbers up, so you guys might wanna get your pencils ready. Okay, for every, let's see. For every x-ray that you have, if it is a blue card, if you have something wrong with your respiratory system and you get a chest x-ray, you're looking at $370. Okay, and where did I put that number? Oh, average hospital stay is $700. So if you have a red card with no exclamation points on it, that counts for $700. Red cards with exclamation points, $700, plus the $370 for your chest x-ray. Okay, and if you want to write the total for that one visit on the back of the card, so like flip it over, if you have a black x-ray like yours, this first red card, so he has a red card which is $700 plus the black x-ray exclamation point. So on the back of this card, you're going to take $750 or 7 plus the $350. Does that make sense?
Mhm.
And write the total for that one visit.
I thought it was
Wait, was it
Sorry,
370.
370. You're right. Sorry, 370. So for the total for this visit, write the total on the back.
So I thought you said red cards were 700?
What's
Yep,
the?
red cards are
370.
700.
Right.
Red.
It is.
We're getting there.
So 7.
Okay, so yeah, so
So
you're gonna do the
700 plus
700 plus.
370?
Yep,
Yeah.
700 plus 370. Okay, and same thing for your second red card.
So just the 370.
The 370 plus the 700 for the ER
So
stay.
I have to add all
Oh.
3 of these together? in
Not
one
yet.
card?
Not yet,
Or
just
just write
per
the-
card. We're going one card at a time. So for your 2 red cards. If you have, oh, I'm sorry, that was your blue, oh, can we rewind? Sorry, my fault. Your blue card, I'm sorry. Blue card is 700 plus the 370 for your x-ray, if you have one.
So wait, what do we do?
Just hang on to the red card, sorry, I got my colors mixed up, it's my fault.
So the blue card would be 1,070.
Yes.
Unless you don't have one.
If you don't have an exclamation point, it's just the 700 for the visit, okay? Yes.
So it's just 700 if you don't have the exclamation point on it.
Yes. 700 if you have no exclamation point, 1,070 if you do.
Oh, that was for the blue.
Yes, that was for the blue, sorry.
Sorry.
Okay. For, let's see, for your green cards, illness cards, $700 again, okay, because we're going to the ER. If you have a red exclamation point, that means you were admitted to the hospital, okay, 16% of all people who go to the ER are actually admitted to the hospital. Okay, your normal hospital stay is going to cost roughly $9,700. Okay, so if you have a green card and you're admitted to the hospital, we're talking $9,700, and a red exclamation point, red exclamation point on any cards is $9,700 for being admitted to the hospital. Okay, otherwise, again, just a straight 700. Okay, red cards, same thing. If you have a red exclamation point, add $9,700.
On the-
Black exclamation point, yep, for your black exclamation point. These are injuries, so we're talking like bone injuries, right? Like if you break your arm, $1,400 for a bone x-ray.
So
Are we back
700
for the red?
still.
700.
So 9,700 plus what?
Okay, so for yours, you have a black one. You're going to add the $1,400 for the x-ray. And then you are going to add $9,700 for your hospital visit. These add
9,700?
$9,700.
I thought that was for the red exclamation point.
The red, yep, red exclamation point is $9,700. Black exclamation point is $1,400.
So it's still 700 just for the card.
Just for the card, yeah.
So 700
700
plus.
plus your 1,400 for your hospital, or for your
Okay.
x-ray. Make sense?
Uh-huh.
Okay, these numbers adding up pretty fast? Yeah, okay. Now I don't have any way to add this in, but just kind of throwing this number out there. 59% of everybody who goes to the ER is gonna be prescribed some type of medication. Okay, so you're talking anywhere from like $25. You can get like an asthma inhaler, like that's my major expense. I pay roughly, I think it's like $75 per inhaler. I get about 5 of those a year. So this is kind of bare bones here. We're not talking any prescriptions or anything like that. Okay, your pink cards. Anybody have any idea what a hospital might charge you to have a baby?
Oh my.
$10,000?
30,000.
How much?
$30,000 is
I
the,
saw that on
well,
TV.
for no insurance, $30,000 is the average bill, at least that's what Blue Cross Blue Shield said, is the
Okay.
average billed cost of having a kid, okay? Between all medications, and we're not talking like C-section, we're talking just normal, no complication type delivery, okay? Average billed cost is $30,000, so for each of your pink cards, on the back, $30,000.
I got 3 babies.
Me too. That's already $30,000.
Okay, and we're just talking before the age 26. Do you guys know what happens to your number of ER visits a year after the age of 26?
You know what?
They go up from there, okay? So just between now and the age 26, these are the numbers that you're looking at. Okay, now, for all of you who have insurance cards, discount all of the numbers that you just added. For all of your cards, you have a $75 copay for office visits, right? Or for the ER visits? Okay, so you guys get to add $75 for each card you have. For your babies, you're looking at probably paying your deductible. So add up whatever your deductible is. After that, your insurance covers it. So while you guys are doing that, the rest of you guys add up all your numbers and tell me what your total.
So all I do is add
$95,000.
The
What's your,
deductible to this.
what's your deductible?
300.
Okay, so not 30,000. For that card, you're only gonna have 300.
Alright,
So
it'd be
700.
I only paid 4,300.
So it's
For your baby?
Yeah.
So
Yep.
okay, so like that, and then I had 75 to each one of these.
Yep.
Alright.
it's 700.
2,
42.
62,000.
This is 104,600.
So
104,600.
Yep, 75 is your copay for or for hospital visits.
Mine is 94,200.
And that's with insurance?
$1,000 is
Plus, did you add your $30,000 for babies in there? And you got 90,000?
94.
94,000, okay? $94,200 you're looking at spending just for hospital visits. Okay, we're not talking doctor's visits or checkups or anything like that, just for hospital visits. Between now and the age 26, you're looking at spending $94,000.
Mine is 104,600.
$104,000? You got that?
600.
You got that in your bank account?
You want us to add all this up now?
No.
Yep, go ahead and add yourself. Does anybody with insurance
My
have their
grandma
phone?
probably knows. She's rich.
Not yet. Do you know what you're at now?
I don't have
You're
one.
looking at 63 grand.
just like to keep change and start using.
I'm 104,970.
Yeah.
Does that seem about right to you?
Yeah, well, and each of
that?
you's gonna have a
Does that
little
seem
bit.
about right to you?
It doesn't.
65.
I'm really still stuck on the.
970.
The baby one, well,
Yeah.
and there are a lot of different statistics for the baby one depending on where you're going. Like I said, that was a Blue Cross Blue Shield statistic. And it just said the average build. And it seemed a little high to me.
Little, like,
But-
it like, what was billed to my insurance company when I had both times when I had my kids,
Yeah.
it was about like 70 something, so 7,000
Yeah.
something with my first kid, and like 8,000 for my second.
Yeah, and so I'm not sure exactly where they're pulling those statistics
Me
from.
either. That's what,
But, we're gonna get there too, because, we're gonna talk a little bit about what drives those healthcare costs up,
well, but
Um,
also,
because it's crazy.
I'm also curious, like, what
Yeah.
information,
I agree.
who's providing information to consumers too?
Yeah.
Because
So you got yours just
where are they getting their numbers?
Yeah, and I'm sure they're like, I looked at that like when I was doing my research, how much of that has been manipulated to what makes certain things work. So that's part of it too, but kind of, we're just gonna kind of roll with those numbers. Okay, so what kind of numbers are we getting from insurance?
44,500.
44,500, that's a little better than 100,000, right? Okay, anybody else have insurance numbers?
51,000.
51,000, okay.
Yeah, Baba.
3.
Those kids are looking expensive, yeah?
Yeah, no wonder.
You guys are expensive tax deductions, let me tell you.
Have a kid at home.
$95,970.
Yeah.
I
And
need a pair of
90,000 of that
scissors.
come from.
What?
I can't home.
Yeah.
Here's the pair of scissors.
Expensive, okay.
Cord, and then
All right,
there's
so our
kids
numbers from insurance are looking a little bit different than our numbers for non-insurance, right? Okay, so if you have, what'd you say, $50,000 for your insurance costs?
Gilbert.
40, 44,500.
44,500, that's less than half of what you're gonna pay, right?
Yeah.
Okay, now it's gonna be a little bit off because the average premium costs anywhere between $200 and $300 a month. Okay, so you're gonna end up paying, on average, about, what was it, $14,000 between now and the age of 26. So you're gonna add $14,000 for insurance, which is any kind of health care, right? But even with $14,000 added to your total, does that equal your total? No, we're talking thousands less, right?
Yeah.
Okay, so now,
It's only even half.
58,500.
we're talking, the Affordable Health Care Act, let's see, average number, or average amount you're gonna spend on healthcare is $200 to $400 a month. If you qualify, there's some different things that go into that, okay? So you look at that insurance number and you say, okay, I'm paying $300 a month for insurance. That doesn't, that doesn't include my deductible, that doesn't include all this other stuff. I mean, that's way different than what you're gonna pay, right?
Yeah.
So can we say that health insurance is important?
Mhm.
Can save you like thousands of dollars in the long run, right? Maybe you're gonna pay a little bit more out of pocket for your insurance, but it's gonna make a big difference long run. Okay, now here's the big difference with the Affordable Health Care Act. Here's some of what this has changed for you guys, okay? This isn't changing for your parents because they've already done all this stuff, okay? This is really gonna hit home with you guys. This is where it's gonna change. Average premium between $200 and $400 a month. But here's the deal, is if you qualify for Medicaid, you pay nothing, okay? And you pay nothing when you go to the ER. And you pay nothing for prescriptions. And you pay nothing to have a kid. Okay, that stuff is covered. It's not free. I mean, taxpayers pay for that stuff, but you don't pay anything for it. Okay, and people are saying, oh, well, I can't afford all this. You make $16,000 or less a year, you qualify for Medicaid. Those numbers have gone up with the Affordable Health Care Act. That's like, I think, 140% of poverty line. Okay, so those numbers have gone up. There are going to be more people who qualify for free health care now. Second thing, you qualify for discounts if you make $45,960 or less a year. Okay, the average Wyoming teacher's salary, okay, is $43,000 a year. Okay, so your average first-year teacher is still qualifying for discounts on some of these premiums. Okay, average income for people under the age of 25 in Wyoming, this is a Wyoming statistic, is $32,382. Okay, if you're making $32,000 a year, do you think you're going to be able to come up between now and the age of 26? Are you going to be able to come up with that $100 and some odd thousand that you have to pay for health care?
I don't know, maybe.
Okay, that's no vehicle payment, that's no rent, that's maybe some food, kind of a deal. You have to, on top of all of that, pay for these health care costs. Okay. Here is why healthcare costs are going up. Here's why it may cost you anywhere between $7,000 to $20,000 to $30,000 to have a baby. Okay, if you're a hospital, okay, not doctors' offices, but hospitals, some of them, Wyoming Medical Center. Whether you have insurance or not, Wyoming Medical Center is required to treat you. Okay, you walk in with a broken arm, you walk in pregnant, whatever. Wyoming Medical Center is required to care for you. Okay, you don't pay your bill because you don't have enough money to feed your family. Where do they make up that money? I mean, they have to pay their doctors, right? Okay, does Wyoming Medical Center, do they get taxes? Okay, they might get some grants, something like that, right? But they can't make that up in taxes. They don't get to tax you. How do they make that up? They have to pay their doctors, they have to buy needles and stuff like that. Costs? Yeah. Okay, who pays those costs? If you can't pay the medical bills you already have, do you pay those
Insurance
costs?
companies?
There you go. Okay. So when you pay insurance and your insurance says, oh, you only have to pay $75 a month, do you care how high medical costs are?
Yeah.
Should you? Maybe.
Yeah.
Do you? Maybe not as much as you should, right? Do you care as much as somebody who doesn't have insurance?
No.
No. Okay, so do you see how this kind of snowballs? If you're a doctor and you're working at a hospital and you're going, okay, all of these people over here, they're charging $100,000 and they can't pay it. And I have to make it up somewhere because I need paid, my family needs fed. I have all of these supplies to buy. The best thing I can do is hike my rates and hope all these people with insurance, hope their insurance will cover it. And that's what kind of got us to the Affordable Health Care Act. That's what we're looking at now is that, like we're looking at bankruptcy type deal. Wyoming Medical Center was not looking so hot not too long ago. So what the Affordable Health Care Act is trying to change for you guys on whole is the eventual kind of overall costs of health care. So I guess I kind of have to ask you guys, as far as your opinion on your health insurance, your coverage, has this kind of made you rethink some of that? I think it's maybe a little bit more important if you're looking at a $100,000 bill. Maybe a collection on your credit. Okay, you have a collection on your credit, maybe you can't apply for a car loan, maybe you can't apply for a home loan. That's gonna change a lot of things for you. Are we thinking maybe healthcare looks a little more important now? Yeah,
Just get the right healthcare, I guess.
yeah. And like I said, maybe you're a lucky one, maybe you get a job, you know, you go to college, you get a job that covers all your healthcare. Awesome. I'm on my husband's insurance, I'm loving it. I'm like, yeah, we don't pay anything for us, we don't pay anything for our kids, we pay our deductible, that's about it. But I don't worry too much about it. If he got fired, my daughter's braces, they're coming off, man. Can't afford those because they're expensive. Her braces were $8,000. Yeah.
Yeah,
The worst,
Crazy.
no.
but even insurance though, with, as far as orthodontia, the
Yeah.
maximum's $1,000 on most plans.
Yeah, and ours is a little bit higher, but I mean, that's kind of, yeah, it's
Dental plans
expensive
suck.
either way you go.
But
Yeah. But
helps.
this is kind of some of the, these are just kind of some of the things that are changing for you guys. Like I said, that was kind of the purpose today, was kind of to kind of mess with the numbers, so that you guys kind of get a better picture of what you're looking at as far as healthcare goes. And kind of my goal was to make you rethink health insurance and say maybe it's worth that $200 a month, or hopefully, hopefully you're looking at jobs that'll cover you.
Very cool. How I look at insurance is it's kind of like, some of my money I put in the stock market so I can watch it grow. Some of my money I put in to insurance plans so that I can have more money at the end of the year because, and if somebody asks me, whatever I purchase or whatever I buy, you want insurance with that? Usually the answer for me is yes. Because I've seen how it pays in the long run. Because my first career in 10 years was selling health insurance. And when you see what healthcare costs and then what folks end up paying, versus what the insurance company had to pay, you're like, wow, wowie zowie.
Yeah.
What I pay in my premium is far worth what that poor insurance company got stuck with. But see, that's that other piece of this Healthcare Act that I feel really bad for is the health insurance industry. I feel real bad. They've been a little bit evilized, when this Affordable Health Care Act came into play. But truly, they're not really an evil empire either. They're stuck in the system, just like Wyoming Medical Center is
if you're a
stuck in
health
the system.
insurance, if you think about it, you're a health insurance company and somebody's paying you, they pay you $200 a month, they get hurt and you have to pay out $20,000 for x-rays and setting a bone. My daughter broke her arm, she had to have surgery, took a couple hours, they had to reset, she snapped part of her bone completely in half, flipped it around the other direction, they had to reset it, so they were paying a doctor for that time, the anesthesia, everything like that, those costs go up very quickly. So my insurance company got stuck with that whole bill and I'm like, ooh, I paid
And you paid 2
$75.
months of premium.
And I paid, a couple months of premium.
That's what they made off their family
yeah.
before, bam.
Yeah, so it's a tough market,
Yeah.
but from your guys' standpoint, now here's one of the other things that I'm going to kind of throw out there is that people have talked a lot about getting fined. Why are we required to purchase something? How is that right? And the fines that go along with it. Just kind of throwing these numbers out there for your first no car insurance ticket, up to $750. For your second no car insurance ticket, you're looking up to $1,300. Okay, that could be within days. You get pulled over, you have no insurance, bam, $750 you owe. You get pulled over the next day or like an hour later even. You get a second no insurance ticket, that's up to $1,300 that you owe now. Okay, third time, the judge is required to basically impound your vehicle. He takes your vehicle, the license plate off your vehicle, and he does not give that back to you until you pay all of your fine and you pay to get insurance. Okay, if you have gotten speeding tickets and stuff, you may not be able to afford that insurance. But all of that stuff is just for car insurance. The Affordable Health Care Act fines people the first year $95 for no insurance. Okay, compared to car insurance, $95 a year, it goes up to I think it doesn't go up to $750 till like the fourth year that you don't have insurance. 1 year, $750. But that's not what's going to really kick you. What's going to kick you in the butt is the cost of your health care if you don't have insurance. It's not Obamacare. It's not the Affordable Health Care Act. That $95 a year, I would gladly pay $95 a year versus the $103,000 that I'm going to have to pay if I get hurt or sick and don't have insurance.
Plus, the cost just isn't, because for you, the cost is also for society altogether. you know,
Very much so.
because so many people have remained without health insurance.
Yeah.
Those of us that do, our claims are actually the ones that are paying back the ones out there that don't have insurance are paying back the difference between what the public has had to come up with to cover the costs of those that are uninsured. So choosing to walk around without insurance affects everybody else in addition to. Yeah. So that's why you get fined for no car insurance, because by golly, if you hit my car and you don't have insurance, you just costed me, buddy, right? That's not right. So what we're saying is, because, you know, apparently citizens don't feel that external responsibility, now we have to manage you and say, guess what, you know, it does affect other people, and, you know, here's another way that government has to step in and say, look, this is more about yourself.
Well, we
You
talk
know,
a lot
this
about
is our community.
Yeah, we talk a lot about government spending in the last couple of years. You know, we've got a lot of stuff going on, and people are saying, well, why don't we cut the president's pay rate and all this other stuff? I mean, you guys have heard it all, right? Okay. One of the things, a huge chunk of the taxes that you guys will pay when you start working, if you haven't already, huge chunk of that is going to healthcare costs. So, just kind of, that's my food for thought for the day.
And it's not because Obama's evil. A lot of people are saying that. It's because we've gone too many years with too much of the population without health insurance. You know, and it's got to get paid back somehow, back into the system.
So you guys have, that's kind of my spiel.
That's
Do you guys
awesome.
have any questions?
You said the insurance has to pay it when someone can't pay the hospital money, right?
Well, if you have insurance, your insurance covers their part. If you can't cover your part, that's between you and the hospital. It has nothing to do with your
Alright,
insurance.
because I was wondering, like, where does the insurance get all this money from?
Well, when you
If
pay
they're
your
paying.
premium.
Um,
When you pay, you know, like I said, your premium can be anywhere between $200 and $400 if you have a really nice employer. And that's part of the Obamacare when they're talking about companies, like big companies being required to provide insurance. Part of what happens is if you go get insurance for you, you might be paying $450 a month for insurance. But if you and 400 other people say, hey, we're all going to pitch in, we're all going to pay you this much money a month, maybe that insurance company is going to say, hey, you know, we can make our money off of this. So we're going to cut you a break, and instead of paying $450 a month, you guys can pay $350 a month. So that's where employers are being required to provide you guys with insurance. It's because they qualify for those group discounts that you guys wouldn't by yourselves. Does that make sense?
yeah.
But yeah, insurance companies, I mean, that's where they have to make their money. If you paid nothing for insurance, I mean, Obamacare, you know, when they charge you the $200 a month, what that's going to eventually go to cover is those medical costs that at some point in time you will incur. And like I said, this time period, I mean, 18 to 26, that's what you guys are looking at here in the very near future. But that's not the worst of your medical bills by far. You get beyond that 26, beyond that 30 mark, and all of a sudden your rate for heart attack goes up, your rate for stroke goes up. All of the things that might play into getting you into the hospital. First off, those things are more expensive. A heart attack is way more expensive than a broken bone. Way more expensive than stitches. So you're looking at paying nothing but more than this as you get older. So they're trying to make their money off of you now so that when you get older they have the money to pay for your health care. Thanks guys. Sorry.
Thank
Like,
you.
That's kind of my spiel for the day.
Thank you, Kenzie. That was really useful, I think.
Sorry, I hope it just gave you guys, like I said, hopefully it just gave you some food for thought more than anything. Something to think about.
Did you research every trip across UNC costs, like usual and customary costs? Do you want to stuff?
No, those are construction paper. My kids might wish that I hadn't cut up their construction paper, but that's not it. No, I didn't. Like I said,